I'm Randy Patterson from Changeways Clinic. One of the most central elements of human development is the transition from sustenance by caregivers to relative independence, from adolescence to adulthood. And yet in countries all over the world, young people are increasingly struggling with that transition. In Japan, the problem is called Hikikomori. In the UK, it's NEET, not in education, employment, or training. In North America, failure to launch. And in almost every case, the majority of these individuals are male. Something is going wrong for young men at the cusp of adulthood. When I ask groups of therapists if they've seen these individuals, I can count on 70 to 80% of the hands going up. And yet, where's the literature? Where are the treatment guidelines? There aren't many. Clinicians are left to stumble along and try to figure out how to help. In this program, I'll show you what we know about this phenomenon and provide treatment strategies that seem to work. We'll look at the boundaries of the phenomenon. What is it? When does it happen? And how long does it last? We'll consider the origins of the problem. How does it come about? These include economic factors, aspects of the educational system, parenting, and individual characteristics. And once you have these individuals in your office, what do? We'll look at a variety of techniques. Detriangulating yourself from the referral source, getting the client's own vision of a better life, examining the function of the avoidance, and how to fulfill that function in other ways. Identifying skill deficits and the building blocks of functional adulthood, using goal setting and huge amounts of support to assist the person in taking those first outward steps, and reorienting their thinking from fears and incapacity to talents and proven abilities. We'll also consider the role of other family members, whether bringing them in for occasional meetings along with the identified client, or working with the family as a whole, or seeing parents as primary clients. We'll also consider early detection and what parents can do to prevent these problems from developing in the first place. So join me for this 8-hour continuing education examination of a large but largely unexplored area of clinical practice. You'll get a PDF of all the text slides, plus a set of resource materials that you can reproduce and use in therapy. Whether you're coping with this in your own family or over and over again in your office, I think you'll find it very helpful. And if you don't, there's a 30-day money-back guarantee.